Hi, I am Dr. Cherie Richey, Managing Partner of Columbus Women's Care, OBGYN. We are a obstetrics and gynecology practice located in Columbus, Ohio. And so that means that we take care of women through all phases of life, from puberty to postmenopause. We deliver babies, we do hysterectomies. Um, and we're really excited in this webinar to educate you about some new services that we have to offer in our office that are right in line with our area of expertise, which is female anatomy. We're going to get started here. So we're going to talk about the FemTouch laser. And I always feel like to appreciate the solutions, we discover one must understand the problems that we confront. And I kind of came up with that quote as I was collecting slides for this webinar, because I think if you understand the problem that the FemTouch laser is designed to treat, then it just makes perfect sense. So let's get into the nitty-gritty of it. So the female continuum spans from childbirth to menopause. And so in childbirth, you can experience stretch marks because of increasing girth of the abdominal wall. You can experience surgical scars if you happen to be a woman who undergoes a cesarean section. And breastfeeding, which is very much promoted and is appropriate and a wonderful gift to give your child. But we also don't talk about the things that continuous breastfeeding for a year can do to the female body in terms of the female vagina, in terms of estrogen levels, and leaving women bereft or lacking in estrogen levels, and how that manifests in terms of vaginal discomfort. With menopause, that's a permanent estrogen loss. Menopause, by definition, means that a woman is no longer fertile and has entered a different phase in her life where her ovaries are no longer producing estrogen. And so this lack of estrogen over time, not immediately, but over time, can cause the vagina to undergo changes physiologically that can result in compromised function, so that it becomes more narrow, loses depth, can become dry and less elastic. And then, of course, bladder leakage. And this is interesting because this spans the whole continuum. So I have patients who, after or in the midst of childbearing or those childbearing years, have issues with cough, laugh, sneeze, and little leaks. And then I have women who are menopausal, perimenopausal, who are having these same issues. And so today we're going to talk about how estrogen plays a role in that, and how FemTouch can help some women with these issues. So let's start with menopause, because I think it is sort of the most direct and easy to understand condition. And so, you know, I always tell women menopause is not a medical problem. You know, be lucky that you get to go through menopause, because if you live long enough, it's going to happen. It's a natural physiologic change, just like puberty is at the beginning of our fertility lives. Menopause is a natural change that happens at the end. And so what can women experience with menopause specific to the vagina? Now, there are lots of other symptoms that as a gynecologist I talk with my patients about. But again, for the purpose of this webinar, we're going to talk about vaginal health. And so itching, irritation, painful intercourse, dryness, and bladder symptoms, urgency, urge, and a little bit of leakage can all be changes associated with menopause or a lack of estrogen. And I'm going to take a moment to sort of dissect some of these symptoms. So when we say itching as women, we oftentimes think about that severe, intense itching that's associated with a yeast infection. With menopause, it's a little more nuanced. It's not as severe as a yeast infection, but similar. You become more aware of your vagina and labia. And that's the same to be said for the irritation. Painful intercourse is normally not something that most women experience. And so that is a completely new symptom, unlike anything else. For a woman who enters perimenopause or is in an estrogen deficient state. And then the bladder symptoms, not as severe as a UTI, but a sense of a little bit of pressure and urgency, or an inability to hold your urine effectively, or at least as effectively as you were able to when you were a younger woman. So what causes these changes? And we've kind of hinted around and we've said estrogen. So when the ovaries stop producing estrogen and progesterone, that can facilitate these changes. Hormone levels decrease. And so specifically within the vagina, you can note that the walls of the vagina become thinner and drier, and even irritated. So when you think about, and we're going to say vagina a lot, this is a closed webinar. We're going to be very honest about our discussions, but speak in a respectful way. So when you talk about a vagina in a younger woman, it's pink, it's lush, it has moisture associated with it, it has stretch, it has what we call rugae, which are little folds in the vagina that allow it to expand to accommodate a penis for intercourse or the delivery of a baby. A vagina has to be like an accordion when you think about its responsibilities. And so as you lose estrogen and you lose these hormones, the vagina becomes less functional because you don't have that elasticity and stretch. And so when we talk about the bladder symptoms that can be associated with losing estrogen, we go back to embryology. And what we know is that the cells that make up the vagina, those cells also are the cells from which the bladder and the urethra are derived. So these cells are very similar and have the same estrogen receptors throughout. And so again, when you lose your estrogen, the urethral lining becomes thin, similar to what happens to the vagina, and this can lead to bladder control issues. So this slide basically gives you a visual of what I'm verbally describing to you. So it's a little disorienting because I'm not sure which is your left or right, so bear with me. The portion of the slide that's labeled superficial, intermediate, and parabasal is showing you an estrogenized cross-section of the vagina. And so you can see how thick that lining is, how many layers there are to the base layer of the vagina. And you can see sort of that wave-like fold that's showing you the rugae or the accordion-like folds that will allow this vagina to stretch and still remain intact and healthy. And if you compare that to the opposite photo, you can see how thin that layer is. And so this lack of estrogen is what leads to the itching, irritation, and even bleeding when this vagina is asked to stretch. Again, another visual slide so that you can see what we're talking about. The vagina changes in terms of its caliber, in terms of its ability to function, to stretch. It becomes narrower, it becomes shorter, and all of these things can lead to intercourse feeling different, and eventually for some women, uncomfortable and undesirable. So urinary incontinence, what exactly does this big word mean? I think that most of us who've watched the evening news have seen a few commercials about urinary incontinence, but basically it's the involuntary loss of urine. Traditionally with coughing, sneezing, exercise, or jumping, and that's a specific type of incontinence called stress incontinence. There's multiple different types, but stress incontinence is the one that we're going to focus on here. The reason that this happens is the anterior wall of the vagina is designed to provide some support to the urethra and the bladder. And so when we use these terms, let's also give you a description. Think about your bladder as a teapot and think about the urethra as the spout. So when that teapot tips over, tea comes out of the spout, all right? The spout is the urethra. If you have something, a sling or support underneath that teapot, then suddenly that pot isn't going to spill over and leak. So think about it that way. So by improving the integrity, the vascular plexus around the urethra, the skin underneath the urethra, you can improve some mild forms of stress urinary incontinence, okay? That's all that we're saying. And again, to orient you, remember that there's 3 orifices or openings. You have your urethra where urine comes out. Just below that, you have what? Your vagina. Below the vagina, you have the rectum. So by supporting that mucosa or tissue of the roof of the vagina, you're supporting the area right underneath the bladder. So what's our common theme? Estrogen loss can wreak havoc on the female genitourinary system. It's a natural physiologic process, but for some women, it can be traumatic. And so if the issue is estrogen loss, traditionally the answer has been thought to be estrogen replacement or hormone therapy. Other options are lubricants, surgeries, and pessaries. And let's take a moment here as well. So I feel like, you know, as a gynecologist, I think women end up sort of subconsciously going through this same process where, you know, in your 20s, you don't really think about intercourse being uncomfortable. For most women, luckily, it's not an issue. You get in your later 20s or you've had your babies, you enter into your 30s, you're more thoughtful about the process and the need for foreplay to allow the vagina to get lubricated so sex is more comfortable. And once you've done that, it's fine. We're talking about women who get to their 40s, 50s, and find that, even with adequate foreplay, even with the desire to have intercourse, it's just a little uncomfortable. And so what's the first thing that we do? We go to our pharmacies and we pick up over-the-counter lubricants. It just becomes like something on our grocery list. Oh, it's anniversary, we're going on vacation, I gotta make sure I get a new tube of my KY or my liquid beads or whatever your lubricant of choice is over the counter, without even thinking about why this is happening or what the process is or that it's a physiologic change. And so where I end up having the discussion with patients is they've already started using some lubricants and now that's not working. And so for those women who feel empowered to have that discussion and have the relationship with their gynecologist, that's where we start talking about what the real issue is and what the real answers are. And then pessaries, just to speak briefly on that because it is on the slide, pessaries have nothing to do with comfortable intercourse. That is a device that's plastic. There's many different sizes that's inserted into the vagina to help support that urethra, remember, underneath our teapot, so that you don't have issues with stress urinary incontinence. So this brings us full circle. We've talked about the problem. We have a general understanding of what we're saying our issue is. And so now we're going to talk about the solutions. And so Luminous is a medical device company that has been in this area of providing lasers for surgery for decades, literally since the 70s. They are not an aesthetics company, they are a laser company, and they make the FemTouch. And so what exactly is the FemTouch that Luminous makes? Well, it's a CO2 laser. And so CO2 lasers use a specific frequency of energy to target a specific element in tissue. In this case, the element is water. If you want to sound really smart to your friends, call it the chromophore. So this is what this laser is attracted to, is water. That's its chromophore. And so the laser targets the water in any tissue and heats it gently, causing a change in cellular metabolism and increased collagen production. Collagen production is the key. And even though we say heat, I do not want you to think it's like you're going to be sitting on a hot plate, okay? I've done FemTouch myself. It is not that you feel any kind of warming during this procedure, but we'll get into that a little bit later in the webinar. So this slide really is sort of the marriage of what we've talked about. So we've identified the problem, right? We say the vagina and the urethra have loss of collagen, resulting in loss of elasticity, which can predispose women to have some urgency, some stress urinary incontinence or loss of urine, and also uncomfortable intercourse because the vagina is not stretching, is not lubricated. That's the problem. So to this problem, we add the idea that we have a laser, a CO2 laser, that can increase collagen production with long-lasting effects. You put these things together, and that equals your FemTouch laser. So with this slide, before we move, what I always like to explain to people about vaginal resurfacing with CO2 lasers is that the technology here is old. It is tried and true and has been used in aesthetics for years to decrease wrinkles in the face, to allow for collagen production in the face. There are thousands, if not more, articles on that. What's new here is that we have a handpiece that delivers this energy to the vagina to affect the same change. That's really your take home. Next slide. So this is a picture of the FemTouch handpiece. And so, you know, we affectionately call our FemTouch Big Blue, but it's really not something that you should be intimidated by. So when you look at that handpiece, the blue portion, the slim blue portion is the only portion that's actually inserted into the vagina. The thicker blue portion remains outside. And you can see the little eye down at the bottom. That's where the laser beam comes out, and that rotates 360 degrees, so you can cover the full surface of the vagina. It's very comfortable. We use a little baby oil if you need it. Some women don't. It depends on your degree of discomfort with the procedure. And most patients say it's more comfortable than a speculum exam. And if you're a woman who's had uncomfortable intercourse, this is nothing compared to that. So again, it's a CO2 laser. The result is restoration of lubrication and elasticity that has vanished as a consequence of age or estrogen loss. And it stimulates the cells to come back to a more functional and youthful vaginal state. So the FemTouch doesn't completely laser or resurface the whole surface of the vagina. It's what's called a fractional laser. And what we know from our plastic surgery partners and dermatology partners is that fractional lasers allow for improved healing and quicker healing. It's minimally invasive, and it basically is delivering a thermal energy, which jumpstarts an inflammatory response that is responsible for remodeling the tissue, releasing cytokines and growth factors that in turn allow for collagen remodeling and production. It's important also to realize that the treatments with the FemTouch laser can be applied to the labia or lips of the vagina. And some patients do experience what we call vaginal atrophy or estrogen loss that causes the labia to be uncomfortable. Sometimes insertion is the worst part for some women because that lack of laxity decreases the caliber of the opening of the vagina to accommodate their partner. So if the FemTouch can, be used to treat both areas. And in our practice, we always marry the internal vaginal treatment with the external treatment because I think in our experience, that's where we've gotten the absolute best results. So what can you expect? It really is a pain-free procedure. So we only use a topical anesthetic or numbing cream if we're doing the external treatment, which again, for our practice, we always do unless a patient refuses or doesn't want it. We apply that topical numbing cream and allow it to set up for about 20 minutes. With the internal portion where the actual probe is inserted into the vagina, all you feel is a little bit of a vibration, and then you'll feel it kind of turn as we rotate it. It's completely not painful at all. And then the external, you just feel a little pressure, you hear a buzz, but it's far more comfortable than, say, a laser hair removal process. And since we've been doing this procedure now for almost 2 years, we really have optimized the topical numbing cream that we use, which really makes it super comfortable. The last portion of this slide talks about the time it takes. And so 5 minutes for actual treatment time. The actual time that I am using the laser on the vagina, on the labia, is 5 minutes. That doesn't include, obviously, your numbing time. And women will quickly notice improvements. And I would say in my experience, people do their first treatment and they feel immediately like they have more engorgement, a little more lubrication. That's some of the acute inflammatory response. In terms of the real benefits, I feel in my experience that happens between the second and third treatment. And we'll talk a little bit about what the series of treatments includes and how many. Next slide. So here we go. We're going to talk about it now. So there's 3 to 4 treatments that are usually needed to complete a series, and that's literature supported. The time between the first and second treatment is 4 weeks, so a month, and then between the second and third treatment, we normally will wait 4 to 6 weeks. And then a yearly maintenance treatment is recommended, depending on your degree of atrophy. That will determine whether you would be a 3-treatment person or 4-treatment person. But as with anything, there's maintenance required because we continue to age. And although we are remodeling the skin of the vagina and the collagen of the vagina, it's not like you aren't continuing to age. So you do need to do some maintenance treatments. So who are the candidates for FemTouch? So women who have had babies. Now, when I say postnatal women, I'm not saying a woman who is 6 weeks postpartum. I am saying a woman who is a minimum of about 3 months postpartum, because some of those changes that are associated with the trauma of a vaginal delivery or even just carrying a baby should have improved by the time you get to 3 months. For women who are breastfeeding for a prolonged period of time, who experience some estrogen loss from that, I still would not do the procedure any earlier than 3 months from a delivery. Perimenopausal women, so those are women who are around the time of menopause but have not met the standard 1 year without a cycle with some menopausal associated symptom. So those are women who may be in their mid to late 40s. And then of course, menopausal women. And what I will say is we oftentimes think of traditional menopause, meaning age-related menopause, the natural quieting of the ovaries from functioning for fertility, the ceasing of the cycle. But for some women, that happens acutely from surgery. So for women who have severe endometriosis, who have to have their ovaries removed or have to undergo a hysterectomy emergently after a cesarean section, or for women who are breast cancer survivors or have received chemotherapy that has caused the ovaries to no longer function and produce estrogen. All of these put women in a menopausal-like state. So there's physiologic menopause that's going to happen with time, and then there can be menopause that's induced or occurs because of medical conditions. So what can you expect after the procedure? You will have a little bit of vaginal discharge immediately, and this may be clear, it may be a little yellowish, it may be slightly red, or a little bit bloody. A lot of that depends on the degree of atrophy at the time of treatment. It's nothing that would be more than what a panty liner would need to accommodate. And you may notice a little bit of itching. If you have itching within the canal of the vagina, then there's some over-the-counter personal lubricants, not sexual lubricants, that we recommend, but I feel like that's a very rare side effect. For women who have the labia treated, who may have some external itching, particularly when their underwear rubs, we can make some recommendations of some homeopathic things that you can do to decrease that. All of these symptoms are very mild and short-lived and normally resolve within 24 hours from treatment. We do recommend that you avoid hot saunas, public pools, hot baths for 72 hours after the procedure, and we also recommend that you avoid intercourse 24 hours before and 72 hours after. You may notice greater vaginal sensitivity and a feeling of rehydration. Again, that is because of the acute inflammatory response. So candidates for FemTouch, women with hormone-sensitive cancers such as breast cancer, endometrial cancer, women who cannot do a estrogen replacement therapy, or women who are just not happy with previous hormone therapies. And I'm going to take a moment here also and have a very honest discussion. For women who choose to do hormonal therapy, directed towards improving painful intercourse, so vaginal estrogens, or whether that be in a cream or pill form that's inserted into the vagina. What I always explain to patients is that is not a lubricant. That's not what vaginal estrogen is designed to do. Vaginal estrogen is designed to affect a cellular change. And if you don't use it, you will not affect that change. So it's not something where you can not use it at all and then, oh, I'm getting ready to go on vacation. Let me take my estrogen cream with me. It won't work. What we recommend is 2 weeks of intensive therapy if you're using a vaginal estrogen, where you use it every night. And then after those 2 weeks of therapy, then you use it twice weekly indefinitely until you no longer want to have intercourse or you no longer want to affect that change in your vagina. If you stop using the estrogen cream, your vagina will go back to the state it was in before. And so for some women, the choice to do a FemTouch is an issue of compliance. I'm not going to be compliant with using this cream twice a week indefinitely, or my insurance won't pay for it, or it's a hassle. Whatever reason you make the choice, FemTouch is another option. So who's not a candidate? So I will say, also as a little addendum, that being an OBGYN, being familiar with the physiology and anatomy of the vagina, I feel very confident in FemTouch as a treatment option for the appropriate patient. And so women who have severe pelvic relaxation, active genital cancers, active vaginal infections, pelvic mesh, injuries to the vagina that are acute, or active vaginal bleeding need to be worked up from a gynecologic or medical standpoint, and then determine if that patient is a candidate for FemTouch. And so I would just say that when you make a choice of the type of provider that you want to give you this service, I think you should go to a provider that has knowledge of the anatomy and physiology of the vagina. If I had a patient come in to see me and they wanted a breast reduction, as a gynecologist, I'm not going to do that. And I would hope that other medical professionals and counterparts would respect the vagina and the nuances associated with it as well. Without going into detail, since we've been offering this service, I've had patients see me who are not my gynecology patients, but come in consultation for a FemTouch, and I found other issues that may explain their symptoms. And so it's not our purpose to say that this is a perfect panacea treatment for everyone. It's that for the appropriately evaluated woman, this can be a great option, but not every woman is that woman. This slide just speaks to the financials. When one makes a commitment to treatment for these symptoms with an estrogen cream, the brand name Premarin cream, or VagFem, which is an estrogen pill that can be inserted into the vagina to affect change into the vagina, Osphenia, which is an oral medication that can be used, and then some of the others are over the counters. And these are just monthly expenses that some women may have to encounter if they choose to commit to these therapies. And these are monthly. Now, some of these will depend on what tier these medications, those that are prescribed, fall within your insurance plan. And that's something that you would have to educate yourself about. But regardless of what you choose as a woman to deal with this issue, there's going to be some sort of expenditure. And when we look at lifetime spend on these creams, treatments, and prescriptions, it can make a lot of sense to do something that's 3 treatments with 1 refresher per year, convenience, and it also can be cost effective when you look at it in comparison. So at this point, I would say if you have questions about the FemTouch laser and you would like to set up a consultation to talk with me or any of the other providers here at Columbus Women's Care, we would very much welcome that. And the slide here shows our website and our phone number. Zachra, or Zach, as we affectionately call her, is our billing and aesthetic coordinator who can talk with you in detail about price and payment options. Our office does provide care credit, which is a way of financing your procedures for a year interest-free. You also have the option for paying outright using credit cards, or you can use your HSA or health savings accounts, and she can help you navigate that to determine if that would be an appropriate payment structure. I've been really happy to spend this time with you. I hope you found it informative and not intimidating, and I look forward to seeing you in the office.